As Jim said, for the last couple of years, our chapter has been focused on the idea to really get where we need to be. We have to be involved in, a mass movement, not just trying to organize people who feel, the healthcare injustice in our country and the doctors who are involved in that system. The only way we're going to move forward and get what we need is if we can join with all the other social justice causes, and there's a ton of them out there. So this was our idea when we met with a lot of organizations to try to build something around healthcare as a human right, and learning from James and his experience at the Vermont Worker Center, for which he so deservedly accepted the award tonight. Margaret and Kevin, I'm not sure where I first heard the term a movement of movements, but basically this is what we need to work with all these other social justice organizations. Of course, we know a lot about healthcare injustice, so that's why we're intimately involved in the fight against or fight for healthcare justice, but we can't do it alone. We need a mass movement of people across the country, and just about every person in this country is affected one way or the other by the corporate, conspirators that control us. So a couple of years ago, we said that our organization, we've been around for 9-8 years, so we need to focus on something a little differently, and that was to build coalitions and reach out to other social justice organizations, let them know who we are, and offer to help them, and come together. Now, that's why it's such an honor to have Margaret Flowers and Kevin Zeese here, because these are two of the heroes for activists who have taken up this sort of cause. Not to say James and Shama aren't right up there, but these are the two that we know. Margaret from healthcare, because 5 years ago she was here as one of our speakers, and at that time she had she was in the news and carried a lot of notoriety with her for being one of the Baucus 7 who disrupted the healthcare hearing and got arrested for basically saying, how can this be a hearing on healthcare if you don't allow the only system that would get us where we need to be as a topic of discussion in this healthcare debate. So since that time, first let me go back a little bit. Margaret is a pediatrician. She did a residency at Johns Hopkins, and that's where her home is, and she was a pediatrician for 17 years, 15 years, as that was the way she could serve her community. But during this time, she came to the realization that the best way to serve her community was to develop her full and amazing energy and talents to the cause of healthcare justice. So she was involved in the Physicians for a National Health program in Maryland, and then nationally on the board and as an advisor, and started the Healthcare as a Human Right Maryland campaign, probably also taking some lead from James's outfit and the experience in Vermont. But since that time, she's broadened her scope, and now her main focus is basically getting this movement of movements going, and she and Kevin have started the popularresistance.org that I think everybody in this room should know about and put on your favorites bar. It's, she can tell us about it, but basically it's an amazing resource for advocates of all kinds of injustice to hear about what other people are doing, what the victories are across the country and even internationally. So most recently, she's been working on the net neutrality, and now her full force and energy, and Kevin's too, is on the Trans-Pacific Partnership, and she can tell us about that. So Margaret, it's wonderful to have you back here. Thank you.
Thank you for inviting me back. I have to start out by saying I'm getting a cold, so I'm going to do my best and do my best to make sense to you tonight. But it's really, truly wonderful to be here because this is really a beautiful community, and I feel very welcomed. Thank you for inviting me to be here, and just I'm really enjoying the conversation tonight and thinking how I don't think that we would have this conversation 5 years ago. I think that it's really important for you to see how much you have moved and how much kind of the whole culture in this country is moving, where we're starting to see the importance of these connections and the importance of solidarity and of independent political movements. So, so give yourselves a hand for, just you've really moved and in a direction towards social justice. So I feel like you guys know so much already, and you've done some really tremendous work here in Seattle. But what I wanted to do is kind of share with you some of the journey that I've had, because as we were in there in 2009, 2010, fighting for healthcare justice, seeing it as an opportunity to actually achieve what this country needs and what so many of us wanted, and saw up so close how that was just not going to happen in the current system. Since then, I've taken, I guess if I think about it, it's really kind of a physician approach to social justice. It's about looking at the symptoms and trying to identify the underlying causes of those symptoms, and then what are the effective treatments, right? I'm not doing advocacy because I just like to do advocacy. I'm doing advocacy because I want to make a difference. So how are we going to make a difference? And I think it's really important for us to know, and it's been a real journey for me, and I've learned from people in this room, James, of course, and others. So it's constantly, as we're in this world of social justice, of activism, we need to be learning from each other and learning from our experiences and evolving our practices. So how are we going to achieve healthcare as a human right? I actually would like to say, how are we going to achieve health as a human right? Because it's not just about access to healthcare, and many of you know that if we just tomorrow granted access to healthcare to every person, we wouldn't solve the health crises that we have in this country. We know that the social determinants of healthcare, which I think James and others touched on, having adequate education, having a house to live in, having a job with a living wage, having access to healthy food, having access to clean water, clean air, being treated with dignity, all of these things, being in community, these are things that make a huge difference in our health. And so it's a big task that we take on in trying to create a healthier population, and single payer is part of that. And in addition to that, we've got to see healthcare as part of this broader struggle for social, economic, and environmental justice. Because in this fight, we see that whether it's education or the environment or healthy food or healthcare or worker rights, we're all facing the same obstacles. And we have a lot of crises going on right now in this country on a lot of fronts, but they are rooted in systems that are causing them. And I think Don Berwick, who is a pediatrician who was head of CMS for a while, and one of the things that I remember that he taught me is that, and maybe this is like, duh, everybody knows this, but it was just profound to me when I read it, that he said this, just systems create what they're designed to create. So, we're in this system and we're getting these results, that's because that's what this system does. And so if we want to change the results, we really have to change the system. Thanks. And so what are we looking at? We're in this situation now, locally, nationally, globally, where we're in this drive towards commodification of everything. Yeah. Okay? And it's privatization of everything. And democracy, democracy is under attack in this country. I mean, we just did our radio show this past week. We had a few guests from Detroit on our show. a member of the Detroit Public School Board who's operating in exile because the board was kicked out. They had a $100 million surplus and a $1.5 billion bond, and the state saw that and they wanted it. So they kicked out the school board, put in an emergency financial manager, and they've looted the entire amount. They've shut down schools, they're cutting the teachers. I mean, it's a situation where the kids' test scores are falling, and they're starting to look at alternatives, like can we do freedom schools? Can we do Saturday schools? Are there ways we can start to meet our student needs? And when the state had a ballot initiative to prohibit an emergency manager being put in place, and they passed that initiative, the state just rewrote the law and undermined that whole work, and just, so much for democracy, right? So this is the situation that we're in. I mean, this is something that we have done as a country, not us personally, but our policy as a country has been to do this throughout the world in the global south, and now we're seeing it, it's worked so well there, it's coming back home to here. And so this is it's not fun to talk about these things, but we really have to understand the reality of the situation that we're in. And I call it an epidemic of neoliberalism. It is. It's everywhere on every front. This is what we're facing. And so there are all these crises, but at the same time, I don't get down about those crises because they're also opportunities. And there are opportunities for us to think boldly and act boldly and change the system and create systems that actually won't create these outcomes, that will actually create a more just world, a more equal world, a more sustainable and peaceful world. So this is a huge opportunity, and it's up to us to take this opportunity and be bold and make these changes, and I'm very excited to see Shama doing that here in Seattle. So I'm really glad that you opened up some space for me, both of you, because I think, if we're gonna look at the root causes, and I've had pushback, from saying these things, but we have to be able to say that capitalism is the problem, right? We have to say that a system which requires growth, where profit reigns and people and the planet can be exploited, is a system that needs to change. We can't have that system anymore. But we also have to look at the other systems that are out there. We have to look at imperialism, at a world, a country where we're spending so much of our tax dollars on creating violence and instability all over the world, and not using those resources here at home to lift up our own population. We have to talk about racism. I mean, it is deeply ingrained in our country. And so as social justice activists, if we don't want to keep making the same mistakes, we have to confront this and deal with it and talk about it and learn how this has happened, what sustains it, and how we change that. We have to talk about colonialism, because the American genocide is continuing. And it's a history that many people, our children are not taught this history, but we still continue to exploit our Native American communities, and we need to stop doing that. Thank you. So today is the final day of the World Social Forum that's been going on in Tunisia. And the World Social Forum was started in response to something called the World Economic Forum, which happens every year in Davos. And at the World Economic Forum, all the global elites come together, and well, I don't know what they do there because they don't tell anybody what they do there. But I do know that they've put together something called the Global Redesign Initiative. And under this initiative, the basic philosophy, and we've been looking at this, it actually goes back to 1967. And I'm blanking on his name, Kevin. The guy, what's the guy in 1967 that said, George Ball. George Ball. Thank you. So in 1967, George Ball said, nation states are just really outdated. Nation states, they're like obstacles, they get in the way, they're slow, they don't allow us to change. But corporations are so efficient because they can take resources from one country and labor from another country, and they can make things and ship them to another place. And if things aren't, if the resources aren't there anymore, they can just go to this other place. And so there was really this philosophy, this ideology starting to develop of, we need to get rid of nation states and replace them with multinational corporations making the decisions. And kind of, de facto that's happened, right? The multinational corporations are determining our policies in many ways. They're determining how our workers are treated. They're determining the distribution of goods. And even there was a study this past year, if you didn't see it, by Gillens and Page out of Princeton and Northwestern, where they actually looked at the United States government and looked at a 20-year period and the public policy that was passed. And they found that overwhelmingly our public policy was favoring the wealthy. And so they said, this is, we live in a plutocracy. It's just, now it's a scientific fact. And even at this last World Economic Forum, there was a reporter from Bloomberg News who was interviewing an economist from New York, and he said, so tell me, how big is the plutocratic effect this year? And the economist said, well, it's actually quite significant. So, I mean, I don't make this up, but this is the situation that we're in, right? We're in a situation where this is the path. This is what they actually see our global governance becoming. And so we have to know this. We have to be armed with these facts so that we can figure out how we're going to change it, right? But we can change it. So a few years ago, Kevin and I learned about the Trans-Pacific Partnership. It's an international agreement that had started being negotiated under President Bush, but he dropped it, and President Obama picked it up and ran with it. And so for more than 5 years now, this agreement between 12 Pacific Rim countries has been negotiated in secret. It's the first time they ever classified the text of a trade agreement. And it's not actually a trade agreement, it's actually a treaty. But they don't want to call it a treaty, because if they did, it would be harder for, they have to have the Senate pass it with a larger majority. So they call it a trade agreement. But really, of all the 29 chapters, very few are about trade, and much more it's about getting through the back door of Congress, the things that multinational corporations want. So thanks to WikiLeaks, again, the only way that we kind of know what's in this agreement is that they've leaked some of the portions, and they just leaked the investment chapter. And there's something called Investor State Dispute Settlement Tribunal that they've created. And this tribunal we've had some of it kind of under NAFTA, but this is like this tribunal on steroids. It's a tribunal where corporate lawyers on leave from their corporate jobs are the ones who serve as judges, and then they go back to their job. And it allows corporations to sue our governments, even at the local level, state level, federal level, if our laws to protect our public health or protect the planet get in the way of their expected profits. And so if you decide that you're going to, you've raised the wages of your workers, but now that's going to interfere with profits, they can sue you for what they expected to make. And if we, as a community, can't cough up that much money, we're probably just going to change that law and lower our wages. So this is a direct hit to our local democracy and our sovereignty, not to mention that the laws the provisions that are in this treaty, our laws will have to be harmonized with them. So it's being negotiated in secret, and it's going to directly change our laws. So we learned about this, and not many people were talking about it. We would go to activist gatherings, and very few people knew about it, so we spent a lot of time writing about it. And this was really, you mentioned the movement of movements. This was an opportunity to build a movement of movements, because it really affects everything that we care about, from the food that we eat to our health care, you name it. So over these years, we've built, together with others, we've built this huge movement, and now they're saying it's the largest coalition that's come together to fight one of these treaty agreements. And we've beat it back. They tried to introduce fast-track legislation that would allow them to rush it through Congress last January, and when they did that, there were 10 days of actions, tens of thousands of phone calls into Congress, hundreds of thousands of emails into Congress, and they dropped it. It went away. So now they've introduced it again, and they wanted to get it passed in March, and people have been rising up, and they've been protesting at their Congress members' offices, and we've been doing a lot of protests in Washington, D.C. And now they're saying that maybe the earliest they'll introduce it is mid-April. So the movement is working. It's working together. We're seeing labor stand up. Hello, yay. Labor has just, at the national level, they've just been allowing themselves to get hit over and over again, and they don't stand up to it. And this time they are standing up and putting resources into it, and that's a tremendous thing. And I hope it continues, after this on a range of other issues. But so, we, without the billions that the transnational corporations have come with, with just our ability to go to our members of Congress's offices and sit in and contact them and pressure them, we've been able to hold off this agreement. And our feeling is that because you beat back the WTO, and ever since then they haven't been able to move forward, and now they're trying this backdoor approach through the Trans-Pacific Partnership and the Transatlantic Trade and Investment Partnership. If we beat these back, we can say to them, this era is over, give up. We need to do do this a new way, because every time you try to do this, we're going to be on to you and we're going to stop you. So, sorry, that was my turn. Oh,
Seattle Monday.
Of course. And I would be totally remiss if I didn't mention that the Seattle City Council is voting on a resolution this Monday at 2 o'clock that is kind of what we call a TPP-free zone, is to oppose fast track and the TPP. So I hope that you'll be down there. We'll be there. So what do we see in this situation? We see that the traditional tools that we've used to change political power are not really sufficient in the situation that we're in. But there are tools that we can use. We can, build this movement of movement, activate ourselves, and be willing to use civil resistance when we need to get the social change that we need. And back when the health reform process was moving through and I saw what was going on, we coined this acronym ICU. We're in a crisis and we need the ICU. And that's partly my formula for the work that we do, and it's I stands for independent. We have to be independent of political party and hold to our agenda, to our issue, no matter if the politicians are with us. I mean, Shama's a breath of fresh air, and it's wonderful, and you're a rare bird, because no other politicians that I know of actually come out of the movement and are accountable to the movement in the way that you are, and we need more of that. But we have to be willing to be independent. We have to be clear about what we want. Like the table that we have, we're always told what we want is off the table. Well, that table, is a corrupt table. What we want is never going to be on that table. So we have to be clear about what we want, and we have to put it on that table. And then we have to be uncompromising about it. We recently were involved, as David said, in the net neutrality battle. And when we started that about a year ago, it was in April, the end of April, that the rules were leaked, the FCC was going to vote on. And these were rules that were going to create a tiered internet, where it was discriminatory based on your ability to pay. And we knew that that was something that, for us as an organization, that was a fundamental, that was just going to destroy us, because we already have the commercial media that is so powerful, and now we were going to see our internet, which is our freedom of speech in the 21st century, get turned into this corporatized, commodified medium. So we had to change that. And the coalition that we worked with didn't believe that we could get the internet reclassified as a common carrier, as it had been initially, even when we joined them and said this is what we're going to do. And so when 8 days before the FCC hearing where they were going to announce what the rules were going to be, Kevin and I went down to the FCC and had a rally with others. Oh my God, I have so much more to say. All right, and anyway, we occupied the FCC. We were alone at first, but we stayed there, and gradually others came, and by the end of the 8 days, we had the FCC, the whole side of the building covered. They put our agenda on the table. Millions of people spoke out and in support of it. We continued to protest them. We continued when the FCC was trying to put through a compromise, and people within our coalition were saying, well, let's try to make this a good compromise. We said, no, we're not making this a good compromise because it has loopholes. We have to go for the full thing, and we continued to pressure, and we won on February 26th. So that was very exciting. And when we have these wins, we're actually winning for single payer, because what we're doing is we're shifting the power. And we're learning, because the people in that coalition learned, and this was really new to them, that when you are not compromising and when you're willing to get in their face and block their cars and protest outside the FCC, that they will give in. And as you discover over and over again how little, sometimes it's surprising how little it can take when you get in their face, because they're just not used to that. So, all right, so what we're doing, we promote a two-path approach of stopping the things that are really harmful, and then creating alternatives that we want to grow up and replace the current systems that we have. So we call it Stop the Machine, Create a New World. And what's beautiful is that within that strategy, there's room for everybody to be doing the work that you're caring about, and to see that you're part of this broader movement, whether you're working to create an alternative clinic here, or you're working to stop a harmful policy. You're all together, you're part of this movement. So what is my, okay, I want to talk about where we are as a movement. Because we look at the phases of successful social movements, and we're in what is called phase 6. And phase 7 is actually winning, and phase 8 is defending that win and moving on to the next struggle. And in phase 6, what's really important is a couple of things. Political education, and I feel like you guys are really, you're getting that, and so much across the country, more and more people are getting that, of understanding that there's a problem, that the current situation can't fix that problem. And then the next step is building national consensus for what the solutions are. So we want to have a supermajority of people that support the solutions, but then you only need to mobilize out on the streets about 3.5% of the population. The research shows that if we can mobilize 3.5% of the population, no government of any form has stood up to that. So this is achievable, right? We can do this. We can build this movement of movement. We can learn how to be successful. We can get these gains and continue to build off of that and win. So I feel really hopeful about where we're going as a in the future, although it's a difficult struggle. I'm not going to go into the Affordable Care Act, but it falls right in there with the neoliberal economic model. It's sucking our public dollars into a private system that's continuing to deny and restrict care. It's moving us in the opposite direction of where we need to go, farther towards a market-based, privatized healthcare system, and we need to pull it back the other way. So our job as a movement is to be outspoken about that. We can't be afraid to say that. People need to understand that we're going in the wrong direction so that we can go back in the other direction. We need to work in solidarity. I mean, others have already said this, that we need to go to where others are doing their actions and say to them, how can we support you? How can we participate with you? Because what we're really doing in building this movement of movements is building relationships and building community and getting to know each other and talk to each other and find out who each other are so that we can work together to stop things and to create the kind of society that we want to live in. And I think I just want to close with, and we'll get onto the panel, and this is something that I think Quentin has always told me, is that this is a long struggle, right? This is a lifetime struggle for all of us. And so there may be times when you can participate out in the streets and be there, and there may be times when you can't. But that's okay, because we're all still part of this movement, and we have to take care of ourselves. I'm sick, but but we have to take care of ourselves and recognize that we have to find ways that we can also support ourselves and support each other so that we can stay in this struggle together. And so I want to thank you for inviting me to be here tonight, and I look forward to our further discussion.